So sleep is vital for mental health. It helps consolidate memory. It helps concentration. It clears out all the waste products in the brain. And from a mental health or wellness perspective, it helps us regulate our emotion and deal with stress. So really, without sleep, um, we can't function day to day. So I see this typically with a lot of depressive disorders, where people really struggle to get out of bed, and they spend all day in bed. Despite sleeping a lot, they still feel very tired. And that is related to the neurochemistry of the disorder of depression. There are things that they do that don't help themselves as a nature of the illness. So depression makes you very poorly motivated to get out of bed, for example. It makes it more difficult to get out of bed because you also feel like that kind of leaden feeling in your body. Um, and you feel like you don't want to face the day. And so our comfort spot is often bed. So then when it comes to actual nighttime, then they struggle to get to sleep. So they're typically sleeping too much and not at the right times. It's also worth noting that if you act like a depressed person, you will become depressed. So part of the undoing of that negative spiral is getting people up, getting routine in place, that sort of thing. Both conditions increase your level of cortisol in the body. And that means your body is constantly on a kind of threat response, which you can imagine is not conducive to going to sleep. It shifts your circadian rhythm, and especially in depression, that presents with things like early morning wakening. So you're awake for the most depressed moments of the day because your mood also follows a circadian rhythm. Um, and that's really common. It's a really vicious cycle where poor sleep affects your mental health, which also makes you have worse sleep. When you're not sleeping well enough, you don't have those reserves that help with your emotional functioning and your levels of resilience. So it means that any additional stress that comes at you just feels totally overwhelming. If we think of kind of the bucket analogy, having no sleep or lack of sleep already raises the water in your bucket right to the top, and then everything else is going to make it spill over. Well, it is used as a torture mechanism to sleep deprive somebody. And we do see that in kind of a lot of shift workers, for example. The sleep deprivation does affect their mental health. They have much higher rates of mental illness. And they also have much higher rates of physical illness. We know that they have higher rates of um, all kinds of cardiovascular illness, but also cancers. And we think that's probably to do with sleep deprivation, but it is a very difficult area to study. If you weren't to sleep for over a month at all, none at all, then we don't think it's compatible with life. So it's really a serious issue that we do need the sleep. Why we need it to that imperative, we don't understand, but we do need it. So can it cause mental health issues? Absolutely. It is more complicated than that. Normally, there's a kind of synergy between the two issues. The other thing is poor sleep is often a really good indicator of somebody's mental health. So I ask about sleep in every one of my psychiatric consultations, and it can be an indicator for example, for someone with bipolar disorder. Often the first thing to go is sleep, and it's a sign of relapse. Depression, as we mentioned, absolutely anxiety, bipolar, but also things like ADHD. So people don't necessarily think of that one, but that kind of busy mind at night. And I suppose one of the core hallmarks of that is not necessarily you're anxious, you just can't switch your brain off. Also addictions. If you're taking uppers and downers, obviously the sleep aspect is considerably deranged. And if you can't sleep without them, and then you can see the huge pressure to take the substance to be able to sleep. So yeah, I would say I can't think of mental illness that isn't related to sleep. It would make you have dysregulated mood, which would present with sometimes irritability or emotional lability, which is where you can't maintain a particular mood. You go from very high to very low very quickly. You might see quite a lot of tearfulness, poor concentration, poor memory, feeling knackered, or conversely not feeling that tired, just feeling very numb. People's appetites are often cut, so they struggle to eat as well. So it really does affect every single part of your body. So this we would call in mental health sleep hygiene. And there are lots of things that you can do to improve your sleep. One of which is very unpopular, but no screens before bed. I generally recommend that the bedroom is just for sleeping and for sex. and other activities should not happen in the bedroom. In some places, they take that to a quite extreme, and they say no, even getting dressed in the morning. Um, and that way you train your brain that actually the bed is for sleeping. They say that if you can't sleep, you should get up, do something restful, and then when you feel sleepy, return to the bed, because the bed is not for being awake in at all. It's not even for trying to get to sleep, it's for sleeping. And you retrain your brain that way. No caffeine, that's a typical one. And the one that surprises people is no nicotine. That absolutely increases your kind of wakefulness. One of the big things that affects your sleep quality is actually when you get up in the morning, not when time you go to bed. So setting a really structured routine is really helpful. A lot of people struggle with Mondays, and that's because you've generally slept in over the weekend. So that change in structure of your sleep makes a significant difference. If you're somebody that has a mental health diagnosis, I would recommend getting help really quickly. We know that quick support really quickly makes a significant difference to the trajectory of any relapse. So just call your mental health professional. If you're somebody that's been working too hard or really struggling, for example, with a baby, it might be the sign that you need to take it a little bit easier. You might need to lean on support structures, and don't be frightened to prioritize that. But I think if it's going on more than a week, 2 weeks where you can't sleep, absolutely get support.